Hello everyone, I'm Dr. Nicholas Petruzzi. I'm the Medical Director of the Vascular Institute at AMI, and I'm going to be discussing some common questions and concerns pertaining to arteriograms. So an arteriogram is a procedure in which the vascular surgeon or the vascular interventional radiologist accesses the artery using a needle. So there's no cutting, there's no open incisions. And what they do is we access a needle to stick inside the artery, and then a little plastic tube goes over that. And what we do is we inject some X-ray dye, and through the combination of live X-ray and a little bit of the X-ray dye, we can actually see the inside of arteries. That's how this was first developed back, in the mid 20th century, really. But it's come a long way from then. It was originally used as a diagnostic means to see where blockages might be or help plan for open procedures such as a bypass. But technology's come a long way, and now through that same means, we can actually deliver therapy. We can cross blockages, we can use devices to clean out the plaque in the arteries, we can use balloons to open up the blockages, and stents to help keep them open. And this can all be done, again, it's a needle stick and a Band-Aid when you're done. Well, there is a small risk of bleeding with the arteriogram because we have to put a needle in your artery, and that's what actually makes the procedure a longer day. The procedure itself is actually relatively short. On average, it's about an hour, give or take, 20 to 30 minutes. But we watch the patient for several hours afterwards. At Vascular Institute, we're a little bit overly cautious for that. We're not in a rush, to kick you out the door or anything. So we watch for several hours to make sure there's no evidence of bleeding. Fortunately, the overall risk and rate of that is less than 1%. It's quite unlikely, but that would be the one to mention. And that's what I usually discuss with patients at the time of consultation. Well, the day of, they need to hold any of their anticoagulants, things that thin the blood, such as sometimes, and we give them instructions on this, maybe such as aspirin or Plavix, or patients that are on certain blood thinners, such as Coumadin. Otherwise, they take their normal medications, but they're actually told to have no substantial food or drink after midnight. And our nurses, who do a wonderful job, will reach out to the patient several days in advance and walk them through exactly what they need to do the day of. So how do we decide where we place the catheter? We do it based on it's tailored to the patient. So, it really depends. If patients have known blockages in the very distal arteries, and we sort of know this going in because the patients are evaluated by us, the vascular interventional radiologist or the vascular surgeon, at the time of consultation. And based on our physical exam findings, it may change the way we approach and treat the disease. So we may decide to do it from the wrist, we may decide to do it from the ankle or the foot, or we may decide to do it the more conventional means from the groin, which is right underneath the hip joint. From there, that's through the femoral artery. And then that kind of guides where we place the catheter. Patients that have small vessel blockages down in their foot, what we call the plantar arch, we may go right down the leg so that the instruments are long enough to treat those areas. Sometimes we go from the opposite leg depending on what blood vessel is involved. So patients do require a ride after the procedure, mostly because of having sedation. We don't want them operating any heavy machinery or vehicles for 24 hours. They do have a restriction. I tell patients to avoid heavy lifting or strenuous activity for 48 hours. After 48 hours, tell them they can shower, they can take the little bandage that we put on there, and then, no special care to that site. They just put a Band-Aid on there where the needle stick was. After a few days, there's very little restriction, assuming there's no issues. And part of the specialized care we deliver for our vascular patients is that within 24 working hours from that procedure, a member of our nursing staff will reach out directly and go through a whole checklist of those patients to make sure they don't have any questions or concerns, and make sure that there's no issues that might otherwise need to be dealt with. Thank you for watching this video. If you still have additional questions or concerns, I'd like to encourage you to visit our website where much more information can be obtained online. The website address is www.vi-ami.com.